Sharon. Your phone is slider. Hello. Tell them we're about to start, so you have to be quiet. A pleasant good day, everyone, and welcome to the press conference on the update of COVID-19. I am Fennel Neptune, Information Officer in the Department of Health and Wellness. With us today, the panel is the Minister for Health and Wellness, Senator the Honorable Mary Isaac, and the Chief Medical Officer, Dr. Sharon Bilma George. First of all, we'll have the Chief Medical Officer who will provide us with some information.
Thank you very much, Ms. Neptune. Good afternoon to all. Today, Friday, March 13th, 2020, St. Lucia recorded its first confirmed case of COVID-19. The patient is a 63-year-old woman with a travel history from the United Kingdom, which has reported a total of 323 confirmed cases of COVID-19 to date, with active community transmission. The patient arrived in St. Lucia on March 7th in the company of her husband and presented to our healthcare system on March 11th, 2020. A clinical sample was taken from the patient on that same day and was sent to the Caribbean Public Health Agency for testing. The results were received today, Friday, March 13th, this afternoon, and confirmed that it is our first case of COVID-19 here in St. Lucia. She has been placed in isolation at a medical facility as per established protocol for management of the cases of the virus. As a result of her travel history of significance and the symptoms, health practitioners are currently undertaking the required contact tracing and quarantine of her contacts who have to this time not displayed any signs and symptoms of the virus to date. The Ministry of Health, we shall be providing further updates as the relevant information becomes available. In the interim, all are reminded of the actions that need to be taken to reduce the risk of infection, which include frequent hand washing with soap and water, the use of hand sanitizer with at least 60% alcohol, and cough etiquette as well. The Ministry of Health and Wellness, we assure the public that no efforts are being spared to protect the health and safety of our health practitioners in the care of this individual, as well as the health and safety of the public. Thank you.
Thank you, Dr. Belma. Right now, we'll have the Minister for Health and Wellness, Senator the Honorable Mary Isaac.
Good afternoon, everyone. As you heard, Dr. Belma has already updated you on our situation as far as the coronavirus goes. Our country has now recorded the first case of COVID-19 as of today. I recognize that this situation is one which we all hoped would not have occurred, but one which we have been planning for over the past few months. My team at the ministry has been preparing for this likelihood, and we have now activated our teams to support the management of this case. As the Minister of Health, I can assure you, the public, that I am confident that all is being done to ensure the health and safety of this patient, our health practitioners, and the public, and their health is foremost in everything that is being done at this moment. We always stated that the health of our people in this country comes first and foremost. It is understandable that this announcement will arouse the concern of everyone, but please be assured that there is no need for panic. My team at the Ministry of Health continues to work on all elements of our response to this first case and the possibility of further cases being diagnosed over time. In the meantime, we continue to focus on our capacity response to coronavirus across all sectors of this country. With this focus, even prior to the diagnosis of this case, the following meetings were organized and shall continue as planned. A special meeting of the Cabinet of Ministers is scheduled for Saturday, March 14, 2020, to discuss and review policy options and considerations on how St. Lucia is preparing to cope with COVID-19. On Sunday, March 19th, the Prime Minister will meet with the private sector, union leaders, and all key stakeholders to review and discuss measures by the government and the private sector as to how St. Lucia is positioned to defend against the impact of COVID-19. On Monday, March 16th, there will be another meeting of the National Emergency Management Advisory Committee, NEMAC, to ensure all stakeholders are aware of the plans for St. Lucia and what decisions will be made. My ministry and the government of St. Lucia remains committed to protecting the health and safety of all our citizens. We shall be providing further updates as details become available. I remind you that to date, we have only one confirmed case of coronavirus. While we recognize the possibility of further cases, all is being done to prevent this. Let's keep focus on maintaining the behaviors which we will prevent the transmission of this virus. By coming together with the single purpose of containing this virus, we have the strength to overcome it. Let us do not continue to spread rumors and say things that's going to create panic in our society. We all need to work together to ensure that we do not have a lot of cases on island. I believe that if we work together, we can contain this. And like I've said before, the patient, and Dr. Belma indicated, the patient has been contained and is receiving care as we speak. So we need not panic as a country. We need to remain calm and make sure that we are our neighbor's keeper and we are each other's friends at this time without panicking. I thank you.
Thank you, Minister. Right now, we will take a few questions, but we'd like if you could state your name and your organization, and if you could stand, please. Thank you.
Can you confirm to us whether the female patient is a national or non-national?
The patient is a non-national.
From what nationality?
UK, a patient from the UK.
Miguel Favre, MBC. Two questions at this time. Yes, we've had one required case, but is there any suspicion on the ministry's part that there may be more cases on the island as we speak, considering how contagious as compared to the regular flu and the way it is? Correct me if I'm wrong, but I understood that as compared to a one-to-one transmission. Oh, I'm sorry. I guess I have to go again.
Sorry, yes, there again. Miguel Favre, MBC. The two questions. The first one is there any suspicion on the ministry's part that there may be additional cases as we speak that are not reported? Because we know that there's been some appealing on your part for people to present, if they present any symptoms, to speak up. And I think my second question would be, can you get an update on the nurse who has been isolated as well, test results?
Yes, this morning we had 3 persons in isolation at our medical facility, and we received the results this afternoon on all 3. The other 2 are negative. So the nurse from one of our healthcare facilities, her test came back negative. And the other person that we had is also negative. So we received 1 positive result today, and that's of the national from the UK.
And then as to other cases, is there any suspicion?
Yes, we have another case today, another suspect case today. So the samples, actually 2. We have 2 suspect cases that came in today. And we have sent those 2 samples to the Caribbean Public Health Agency for testing.
But I was speaking also in
When
I was speaking also in general,
Yes.
as in, is there any suspicion that apart
Yes.
from those who have presented themselves to the ministry or the health officials, that there may be people who are not reported?
This case came in with a group, and when they came in, we did the necessary contact tracing for them. To date, none of the other persons who traveled with her have shown any signs and symptoms. Because every case that comes in, we treat it as a case. Although it's a suspect case, we do the contact tracing and we do the isolation right away. So I just want to highlight that her isolation did not start today with the confirmation. She has been isolated from the time she entered our system with respiratory symptoms. So she has been isolated from then. So we'll continue treating her as per our established clinical guidelines and monitor the persons who were in contact with her.
Okay, Delcia Shaldmine again. A couple of things. Considering that she is a British national and most of the cases in the region have been imported from the UK, are we going to be taking any measures in regards to flights and travel into St. Lucia from the United Kingdom?
Yes, earlier this week we did change our protocol when we reviewed the situation report from the World Health Organization, and we noted the increase in cases in the UK and the US. So what we have been doing is persons who travel to the US and the UK who develop respiratory symptoms, we have been testing and isolating them. So that was how we were able to pick up a guest from the UK, because our travel restrictions do not include the US and the UK. But when we noted the increase in cases, we did change our protocol for testing, and we have been testing persons who travel from the US and UK with respiratory signs and symptoms.
And is there any plans to implement travel restrictions on the US and the UK?
For today, for now, no. But the situation is dynamic. We review the situation report and the CDC travel advisories and the necessary risk assessments. We do this on a regular basis. So as of today, but we do intend to review some of the countries that have shown increases. So by next week, we will update you on the extension of the travel restrictions.
And finally, from me, I want to know about school children and teachers. We have Grenada, who has already closed schools for 2 weeks and they don't have a confirmed case as yet. What is our plan? I know that teachers aren't scheduled to meet with officials from the Ministry of Education until next week. We have an entire weekend of possibilities. What is our plan?
Presently, I am not aware of any notice of school closures. We have been working closely with the Ministry of Education on their protocols and policies. Training and sensitization has been done for all of the principals of the primary and secondary schools. So at this stage, we have one case which is an imported case. It's a case from the UK. We do not have any evidence of in-country transmission to date. So we have not put anything in place to close schools today. As I said before, the situation is quite dynamic. As it unfolds, as we note what's happening in countries, decisions will be made on a higher level as to schools, business places, etc.
Shekhar Gillard, Loop News. Can you detail the passengers, the patient's travel history for us, and what airline did she travel?
Okay. The patient traveled from the 29th of February from Gatwick to Grenada on British Airways. From Grenada, the patient spent 7 nights in Grenada and then traveled from Grenada to St. Lucia on the 7th of March on British Airways again.
Kendall Eugene, Blazing FM and The Voice newspaper. With the patient, did she spend any time at any hotels? And also with the weekend coming, a lot of mass crowd events have been planned. Are you going to suggest to promoters that they postpone their parties or their events?
Okay, the patient is staying at a hotel. She was staying at a hotel until she developed respiratory signs and symptoms and was taken into care from there. As I indicated before, we do not have any evidence of in-country transmission, as the persons who were in the company of this patient, none of them have developed any respiratory signs and symptoms to date. We are monitoring all of them. So we do not have any evidence of in-country transmission at this point. So we are not making any recommendations for the weekend on canceling mass crowd events.
Okay, Madam CMO, this question is directed at the Minister, so it will be in Creole. I know you can handle that very well. Prime Minister.
That's an assumption.
I'd rather you do it. Okay. Madam Ministre, Prime Ministre Hutchinson, GIS, NTN, nous voulons défricher vitement situation maladie corona et pour dire exactement comment la situation est présentement à cette ici.
Well, présentement nous ni yon moun qui présenté et puis coronavirus là. Moun sa la sorti l'Angleterre avec nous ja isolate moun sa la avec nous ka traiter moun sa la. Moun sa la pa koy adi dans chambre. Nous savons dat ki moun sorti l'Angleterre et puis y aller la Grenade. Avec qui sorti la Grenade et puis vini cette ici. Il arrive ici à 11 mars avec il commence à nettoyer pour ça prendre l'expiration. So c'est là ça là nous vini savent dat ki il y a problème. Avec nous ni depuis temps ça là on dit dans isolé ça nous dit isolation, so nous pas quitter ni contact et puis pièce l'autre monde avec from là ça là nous ni et puis ici là et puis nous toujours de nous voyer pour un test et puis test la viwe et puis test la dit date qui est positive.
Les venus pour assembler nous apprenons qui décision après pour panier jazz là de ça là. Est-ce que ça a ajouté pour l'autre qualité activité côté tout le monde qui a assemblé ensemble? Est-ce qu'on a considéré Carnival aussi avec l'autre affaire comme ça? Là, c'était un pays qui a décidé pour avoir une pièce qualité, activité, amusement et café. Est-ce que c'est a gardé la direction ça là?
Well, pour actuellement, nous pas c'est jazz tout seul. Nous a dit nous pas qu'à chebe jazz, mais nous la un meeting demain après-midi. Premier ministre, toutes les autres ministres, avec nous avons invité certains monde, nous supposons parler bail, ça nous a dit stakeholders. Avec après meeting ça là, nous avons joint puis numéro encore lundi bon matin. Avec moi l'idée c'est après ça nous avons décidé qui ça nous avons fait, qui ça nous pas fait. Mais pour actuellement nous n'y un seul monde là, avec c'est pas en nation nous, c'est pas un monde qui sort Saint-Lucie. C'est un monde qui vient sortir l'Angleterre, qui mène maladie, avec ces seuls monde nous savent qui ni maladie à cette liste. Okay?
Two questions again from me. The first one is, I would assume that there are different tiers or levels of alert as it relates to our surveillance of this disease. Where are we now? What level are we at? If you could describe them, if there is one. Where are we now? And number two, you said you did your tracing on this our confirmed case. Did that include the hotel and also the individuals who clean her room, I see, and hotel staff?
Yes, the contact tracing includes the staff from the hotel, the guests, and the persons that she traveled with.
In terms of the levels of alert, are we different tiers? Where are we now?
Yeah, okay, we're guided by the levels of alert from the Caribbean Public Health Agency and also from PAHO. Around the 29th of February, before the 29th of February, the risk to the region was classified as low. Around the 29th of February, we moved from low to moderate, and from the 5th of March, the risk level went to very high. If you note, our messaging before that was a lot of preparation, and we focused a lot on prevention. From last week, our messaging was a lot about preparation for in-country transmission. We note the number of cases in the region. We also note the cases were coming closer and closer to home. So we knew it was just a matter of time before we got cases. So we have been preparing the public for the different protocols as to how to manage when we do have cases here in St. Lucia. And the next week, a lot more will be defined as to our community respiratory clinics, our management at the respiratory hospital, the protocols. And as we indicated earlier in the week, we have all of the equipment and the reagent to facilitate testing in country. We were actually supposed to show the public today in our press release the equipment, the setup from the lab, but we will do that next week when we show the training happening for our laboratory personnel, so that persons can see the equipment, they could see the reagents, and they could see the training towards our national capacity for diagnostics.
Rochelle Gonzalez, Hot 7 TV. 2 questions. 1, can you disclose which hotel the patient was staying at? And 2, can you tell us whether her case is mild or severe and whether she had any underlying illnesses?
Okay, the patient is mild, she's stable, she's responding well. I will not disclose the hotel. I don't think we need to. I don't think that's important. But it's good to know that she's doing very well in care presently.
Okay, Kennedy Jean again. With regards to our quarantine zones, how many do we have, and are you going to inform the public to stay clear of those zones? And for education purposes and information, where are they, if you can disclose?
Yes. I don't think it is important to indicate where our quarantine sites are located. It will just bring about more stigma and discrimination. But just to let you know that it is done in a safe way, we are not putting the public or the communities in any level of danger. I think that's the question, right? Yes.
Sheffield Gillard again. What's the mood like of the health professionals who were in contact with the patient during her time of isolation?
As with anything else, we are all human. We note a level of concern. We note a level of concern in the country, and we appreciate that. We understand. We see what is happening with the international media. So we're aware there would be more concern as compared to our other isolated cases which were negative. So we will ensure that the necessary counseling and steps are put in place for all of our healthcare workers who managed this case. But this is a situation that we prepared for, that we anticipated, and as healthcare workers in the front line, and I'm not only speaking about our doctors and nurses, but also our extended support staff such as fire service, it is a job that puts us at risk, and I think a level of appreciation for those persons who put their lives and their families at risk. We have to appreciate that the service that they give towards the care of others.
Okay, not wanting to jump the gun or anything, but then there's been a lot of discussion, speculation, pointing to, I'll use the term shutdown, and they're looking at basically a slowdown of, or maybe shutdown of certain businesses, national entities and everything. What I want to know is, at what point do you think, I mean, this may be for you, Madam Minister, because it's a policy decision, although you'll be guided by the medical professionals, but at what point will it warrant the closure of certain essential, like the schools for sure, because there's talk that, did you happen to say 30%, when we reach a 30% infection rate, that schools will be shut down? This, you see, there's a lot of speculation and stuff going on as to what will it take for us to do these things, because as we know, the children are the ones most likely to pass on the infection by their very habits and their sanitary habits and everything. So at this point, where are we, even though we've only had one case, where are we in terms of taking such drastic measures, or the outlook of us taking such drastic measures?
I'm happy you said it is a drastic measure. And right now that we are emphasizing, we only have the one case, and it is an imported case. So what we are saying is that we are going to, the ministers are going to be meeting, the Prime Minister is going to be meeting with his cabinet on Saturday, and with certain key stakeholders, and at that point I suspect certain decisions will be made, certain policy decisions. And then again you have the Prime Minister and the Cabinet of Ministers meeting with a wider group of people in society, with NIMAC on Monday, and that is really where I think they will solidify whatever decisions have to be made. But we will have to wait until that is done so that we can know what decisions exactly are going to be made. Again, we are guided by the health professionals, and we have to, of course, wait on their advice. The situation is very dynamic. Yesterday, we were in one position. Today, we are in a different type of situation. So as the thing unfolds, then our decisions also keep changing. So by Monday, we should have more answers to the questions that you are asking. But for now, as far as we are concerned, as of today, and of course it's Friday, so school is out anyway. So when we meet on the weekend, then on Monday, the Prime Minister will most likely address the nation at some point, and you will be getting more answers.
Madam Minister, my final question. If you have looked around, you would see the amount of panic that has happened from the time we thought we had our first case with the gentleman from Russia. As a result, we're now panic buying. If you go to the supermarkets, it is like Christmas Eve all over again. So what are your words to the St. Lucian public with regards to panic buying all the tissue paper you could find, all the hand sanitizers they can find?
As you know, we have always cautioned people not to panic. And I know that is easier said than done, right? Maybe in a way it's not such a bad thing for people to be very aware and very conscious of the potential of that virus. But we've always maintained that people ought not to panic. I believe that is unnecessary. But because of social media, you have people posting all kinds of things. I have heard somebody saying how his sister called him from a government office and told him that we are going to shut down the country for 3 months. And, he called his sister and his mother to go shopping and everything else. Now, that is a lot of mischief. And that is not necessary. People ought not to try to create that level of panic among people. Because even when countries say they shut down their doors, it's mostly just to travelers. It's not really to cargo and stuff like that. So we have to be very, very careful when we hear people say anything. We have to make sure we get the information from the source. And I believe that the Ministry of Health, the staff of the Ministry of Health, the CMO, has been doing an excellent job in terms of keeping the country updated. And, these updates come very, very frequent. So I think we have to look at the source of information when we get the information to verify whether that information is true or not before we actually act out.
A couple of things, actually. When does testing begin in St. Lucia now that we've sourced the equipment?
We have received the equipment and the reagent. Next week, our laboratory staff will be doing the training on the equipment. So we estimate that testing should start by the 23rd of March.
And to the St. Lucian public who may feel unwell or feel ill, we have not established the community clinics, the 5 community clinics that we've spoken of. How do you go about being tested?
Anyone who has a travel history of significance to the countries which we had indicated on our list, or you have a travel history to the US, to the UK, or any place that has in-country transmission, or even Martinique, if within 14 days of travel you develop respiratory signs and symptoms, that is fever, cough, sore throat, call your healthcare provider or come in. You can call your healthcare provider and explain to them, or you can come in with your concerns. Persons who fit that description will be tested. We presently rely on the Caribbean Public Health Agencies, as for a lot of the other islands such as Grenada, St. Vincent, Antigua. They've been testing for all of us. And we send up the samples to them for testing until we develop our national capacity.
Okay, and from me, have we informed the Grenadian authorities?
Yes, our national epidemiologist has been in touch with the epidemiologists in Grenada on the situation.
I understand that there is now a COVID-19 hotline. Can you tell us a bit about that and just let the public know how they should use it, etc.?
Yes. The Ministry of Health, in collaboration with the Office of the Prime Minister, is establishing the 311 hotline. Training for the staff of the hotline has commenced. So we anticipate that by the end of next week, this line will be available to the public. It is not available yet, as the training for the staff who will be addressing the issues of the hotline is still ongoing. But by the end of next week, this line will be available to the public who has any questions or wants any information in relation to COVID-19.
Joshua Sentemi from the Star newspaper. Madam Minister, you spoke about the circulating WhatsApp voice notes where the guy was warning that the country would be shut down. The government has in the past sent a message that they would be going after these originators of fake news. We haven't seen any successful case as of yet. Can you speak to that matter, and what is the government doing to control this situation?
All I can assure you is that that is ongoing. Looking into these cases, that is still ongoing, and that is really under the purview of the Minister of Homeland Security.
Madam Minister, offer annoncement to other team là concernant pour mon pas tropical top pair et la parole qui a signé qui gouvernement est plan pour fermer pays généralement. Ou parler à ça en anglais, nous voulons expliquer ça généralement, s'il vous plaît.
Ok, ça nous a dit c'est on chaque monde qui a voyé bagay sur social media, et bien yo ka dit n'importe bagay, yo ka dit bagay qui peut avouer délai. On bagay qui a sur social media c'est côté un monde qui a dit manière, on monde a dit des office gouvernement, couiller famille, et puis dit famille nous ka fermer pays pour about 3 mois. Pour prochain 3 mois. Ça m'a dit c'est ça pas avoué, nous pas encore décider ça. Mais moun nan fait un chay moun père là il voyait dit ça puisque un chay moun commence à aller dans supermarket là et puis amasser toute groceries deck toute bagaille pour tien la caillou en cas si en cas nous fermer pays pour 3 mois. So mon ka dit là autant ces bagaille ça là. On est pour regarder qui moun qui a dit ces bagaille ça là côté ces paroles ça sorti et puis pour ça make sure that qui c'est Ministry of Health qui mettait ces paroles ça dehors et pas n'importe moun. Ou pas ni pour juste coûter n'importe moun. Puisque nous sommes dans une situation côté, nous sommes dans ça, nous sommes en crisis, et puis moun peut mettre bagay dehors là qui fait les autres moun peut. So nous avons dit make sure autant de bagay pour ça vérifier et puis Ministry of Health avant de commencer faire qu'on paie pour rien.
Okay, 3 questions one at a time. My colleagues, myself and my colleagues, I think we understand the reasoning on how prudent it would be to not disclose the name of the hotel. But messages have been coming on our phones by members of the public concerned because we're getting things like people want to have day passes to hotels, they want to be safe. We understand the reason behind not creating the panic, but we're getting requests for the name of the hotel. That's question 1, if you could answer that.
As we have said, Miguel, the name of the hotel is not important because we do not have any case where we've seen any kind of in-country transmission. We have isolated the person who you know, the person of interest, and we do not believe that we should go giving out people's names or the names of hotels or businesses or anything like that, because that will just create more of a panic towards that particular institution, and there is no need for that.
And that's understood. Okay, and also
I don't know if Dr. Belma wants to add something to that.
Let me just indicate that the information we give out is to guide the public on a behavior to improve the condition of their health. If for some reason, whichever resort it was, posed a risk to the public where we would want for them not to go there, we would definitely give that guidance out. From the very day when we noted that we had a visitor with respiratory symptoms that we were concerned about, the necessary guidance was given to the resort to ensure all disinfection protocols were in place to reduce any kind of infection or contamination to the hotel staff and to other guests. So knowing that, we at this point have no advice about any of the resort so it is not of any value indicating the name of the resort, because there is no risk to the public from the guests being there.
Understood. And of course, you would agree that we're still learning more and more about COVID-19, and there are many theories out there. We're seeing even news reports there doctors at times are baffled as to why even a certain race seems to not be, the mortality rate seems to be very low, even the contraction rate. So in that light, the question is, that individual who tested positive, were they Caucasian? Can you state the race, just for that knowledge? Because these are questions coming in. and the final one is, how exactly do you go out of the contact tracing? Could you just describe the process to us?
Yes. We acknowledge, and I think it is very correct what you said, that it is it's a novel virus. This was discovered in January. So even for us within public health, we rely on new information coming in, and sometimes the information can change, but we're guided by the information provided to us through the World Health Organization. And to date, there is no information that indicates that any race is susceptible or resistant to the virus. We do not have information indicating that any race is resistant. And contact tracing is a process where if one person develops an infectious disease, we track all of the persons who were in contact with that person. And the type of contact tracing you do depends on the type of infectious disease and the level of transmission. So with this person, the persons who she traveled with, we are going to do contact tracing. We are also going to do contact tracing for the airline to trace the persons who traveled with her coming into St. Lucia. So all of this information we have to get. We already did contact tracing for the persons at the hotel from the time she was a suspect case, because like I said before, we treat every suspect case as a case. We do not wait for the result to start the contact tracing. We do the contact tracing from the time we suspect a case so that we can get a head start. And the persons so far that she has been in contact with, none of them have developed respiratory signs and symptoms to date.
Earlier, we got news on the cancellation of the Jazz Festival. Now, our next major festival or mass crowd event is Carnival. We've seen Carnival bands sell out already. We've been boasting that it would be a much bigger foreign influx into our Carnival. What is going to happen to our Carnival season?
With mass crowd events and infectious diseases, an assessment that has to be done, looking at the nature of the threat and also looking at the nature of the activity. Also the risk of who attends those activities from overseas, and the risk as to what conditions you have at the activity to reduce the level of transmission or spread during the activity. So for mass crowd events, during transmission of COVID-19, a decision would need to be made. We noted a decision was made for jazz, so in the events company, in collaboration with the Ministry of Health and the Cabinet, a decision will be made very soon, I suspect by this weekend with the meetings happening. So by next week, the public will be informed as to the status of Carnival.
Going on what you just said, I know you said by next week we should know, but we have events like the Grizzly Friday Night Street Jam, where you see a large influx of tourists who come here, perhaps even for just one day. What can we expect for events like these, like street jams, impromptu ones?
We note the influx of persons coming to attend the Grizzly Friday Night and other activities, and predominantly persons coming from Martinique. When Martinique indicated the confirmed case, there were measures that were put in at the port to heighten the surveillance for the vessels coming in from Martinique. And that includes the screening of persons coming in from Martinique. As we indicated earlier, the use of the handheld temperature scanners. We did procure and receive 50 handheld scanners. Presently, everybody who comes from the Express and the different vessels are temperature screened coming in. So we have also heightened the surveillance at the ports in relation to this.
It was mentioned by Miguel earlier about the 30% infection rate before schools can be closed. I don't know if you are aware, but the teachers union has actually put that out in a notice that they are aware, or they heard of a protocol where there needs to be a 30% infection rate before schools can be closed. Can you affirmatively confirm or deny this for me, please?
No, I'm not able to speak to the 30%, but like I indicated, this is a very dynamic situation, and decisions for school closure or cancellation of masquerade events, the level of risk and the capacity in country. So this is a decision that the Cabinet of Ministers, in collaboration with the Ministry of Health, can make. That decision can be made on one case, it could be made on 5 cases, it could be made on 30 cases. So it's very dynamic, a lot more than the percentage is used to determine whether or not schools should be closed. And also another important factor is the level of, is it imported cases that we're seeing, or is it in-country transmission? So a lot of factors go into determining the closure of schools or closing of businesses, and it's a lot more than just a percentage.
Is it because of that reason that you cannot speak on the 30%, or is there a different reason?
Well, I cannot speak to it because it's a lot of different factors. It's not only a percentage that is used to determine school closure. If you note some of the measures happening even in the region, in the countries that presently have more than one case, decisions are being made based on different numbers of cases. So it's not one protocol. We sovereign nations, we assess based on our capacity to manage and also based on the type of cases that we have. So it is not a one number decision.
Things keep popping up. Going back to the contact tracing again. I have a question for clarification. Does this say at the 15 that the virus can survive within 15 feet? Is that true? Well, sorry. My question, to get to my question is, did the contact tracing extend to the airline in which that confirmed case travels? The airline itself, seats behind, seats in front, seats next to, and everything?
We will be. We have not done the airline, but we will
be. Madam?
We will be. We
Madam
had to
CMO?
get a confirmation of the case for us to get. What we need to get from the airline is a seating arrangement to extend it. But contact tracing was done in country.
But you just said, Madam CMO, that the contact tracing, you treat every case like a suspected case. So
yes.
why didn't the contact tracing start right there?
Well, no, not for the airline. The airline, normally what we're told is until you confirm the case, then we would extend it to the airline. But the contact tracing on island, we treat as a case.
And British Airways is aware of that case?
Well, the agent is aware of the case.
Okay.
Yes.
Cruise ships, we know that the vessels are supposed to provide a bill of health to that extent for the passengers coming. That's for the vessels, the pleasure vessels, I know for sure. Could you describe the process for the cruise ship, and do you think, considering the likelihood of transmission in a cruise ship is much greater than in a lot of other cases, are we confident that we are getting the true details from those cruise ships coming in, number one? And number two, considering it's almost the end of the cruise season, is it one time to consider that we may have to take a decision as to reduce or stop, those cruise vessels from coming in until such time that we are sure that we are safer in that sense?
For cruise vessels coming into the island, they submit to us the Maritime Declaration of Health, which gives an indication of the health status of all of the passengers on board. We've met with the cruise industry. CARICOM held a very important meeting in Barbados where we were able to meet as a region and also meet with the cruise industry to develop protocols to guide how we manage the cruise industry. And included in that is for them to give us, apart from the Maritime Declaration of Health, updates on it 4 hours before arriving. And countries also requested information on travel history on the passengers on the cruise ship. If, for example, the country does not feel comfortable with the information provided by the Maritime Declaration of Health, we sometimes do an assessment to see. And as countries, as you know, for us in St. Lucia, if we have any concerns about the health status of persons on the cruise ship, we would not grant permission to dock.
Thank you very much, Dr. Belma George, and also the Honorable Mary Isaac. Well, that's how we come to the end of the press conference as it relates to the update on COVID-19. Once again, I'm Fennel Neptune, Information Officer in the Department of Health and Wellness. I want to thank all of our listeners, and on behalf of the entire production team, I am Fennel Neptune. Thanks for watching.